Good afternoon. I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system and then take actions to try and make a better system for all of us. Before we get started, we're going to be talking about some of the effects that the Trump administration is having on healthcare, and it is, of course, not good. But we'll have actions for you to take. Down below in the YouTube description box, you'll find a link to the Healthcare Advocacy newsletter. That's the text for this video. You can subscribe there for free, get it delivered to your inbox every day. It has lots of good medical and policy advocacy references. It also has all of the links to the studies and news articles and medical publications that I mention here in this newsletter, together with the actions. So let's get started. Science does not matter to the current Trump administration. Under the direction of HHS head Robert F. Kennedy Jr., who, did I mention that he has a brain worm? Did I say that? Anyway, the CDC will reinvestigate vaccine data. The CDC is planning to conduct a large-scale study to re-examine, hold on, whether there's a connection between vaccines and autism. I can't believe it. Anyway, this was debunked decades ago. Anyway, dozens of scientific studies have failed to find any evidence of a link, but the CDC now falls under the purview of HHS Secretary Robert F. Kennedy Jr., the guy with the brain worm, who has long expressed skepticism about the safety of vaccines and has vowed to revisit the data because he can't afford to be wrong. Anyway, I've gone over this over and over in this newsletter. The onset of autism generally presents in children just about the same time that children are busy getting vaccines, somewhere around age 2. Now, let me point something out to you. Correlation to events occurring in near time does not mean that one event caused the other. That's causation. Investigations have demonstrated that this is not the case between autism and vaccinations. But this Yutz Kennedy, the one with the brain worm, he's now going to spend our tax dollars and try to say that he's been right all along. And he's going to do this with false data. This is actually waste, fraud, and abuse. Since this is settled science, he is wasting our tax dollars on a fraudulent vanity project. I have something we can do about it. We can impeach him because he's stealing the money. Here's the action. Call your congressional representative and your senators and say it's time to impeach and convict Robert F. Kennedy Jr. for waste, fraud, and abuse of federal funds for authorizing a fraudulent study to show that vaccines cause autism. In the YouTube description box, you can find a link that will take you to a site where you get their phone number or email, or my favorite way. On your cell phone, all you have to do is send one quick text message and you'll send an email to all three of them. On your cell phone, text SIGN, S-I-G-N, space, P-E-E-P-Z. Well, it came out great. SIGN, P-E-E-P-Z, to 50409. Here's the message you're going to send. I'm your constituent, and I'm shocked to see that there's waste, fraud, and abuse taking place at the Department of Health and Human Services. I want you to do something about it. I see that Robert F. Kennedy Jr., the head of the agency, is authorizing a fraudulent study to prove that vaccines cause autism. This is settled science. There is no causation between MMR, measles, mumps, and rubella vaccine, and autism. Yet he's going to spend my tax dollars fraudulently to create the impression that this false association of vaccines and autism is causation, not correlation. I demand that he be impeached and convicted and removed from office for waste, fraud, and abuse. Those are crimes, and you need to stand up and start protecting your constituents. If you need it, I include the link to the New York Times reference article for you that he is actually doing this. Let's talk about measles for a little bit. While we're on the subject of vaccinations, let's talk about parents choosing not to vaccinate their children because people like HHS head RFK Jr., the one with the brain worm, think that choice, individual choice, is more important than protecting children and the general population. The history of the measles outbreak in the historic measles outbreak in West Texas is just about 200 cases now. Texas state health officials said this last Friday. The number of cases in neighboring New Mexico just tripled to 30. Most of the cases across the states are people who are younger than 18 and unvaccinated or have no vaccine status. Texas health officials identified 39 new infections of the highly contagious disease, bringing the total count in West Texas to 198. 23 have been hospitalized. You want to know how dangerous it is? I've included a link in the newsletter to the CDC webpage. You might want to go and read it before they take it down. Of the unvaccinated, it's somewhere around 20% get hospitalized. Children can wind up with deafness, mental retardation, pneumonia. Death can result. A weakened immune system, because measles forces your immune system to actually forget. It creates an amnesia in the immune system. And there's something called SSPE and subsclerotal something encephalitis. And it is a horrible disease. It is rare. It's about 11 people out of 100,000 infected get it. And it occurs 7 to 10 years after you've had measles, and it is fatal. There is no cure for that. But you know what? You think you don't need to get vaccinated? You're a jerk. Love your kids, get the shot. I want to talk about Republicans and rural poor people, because they've made an important comment to rural America. And here's the comment. Drop dead. Rural hospitals across the United States fear that massive Medicaid cuts Republicans are planning, they're considering this under the current House budget proposal, would decimate, get this, maternity services. They will close already struggling medical facilities in communities that overwhelmingly voted for Trump. Nearly half of all rural hospitals today operate at a deficit. They're only able to keep afloat because Medicaid helps them stay afloat, because so many people in those states are on Medicaid. I think Louisiana, it's like almost half of all adults. Look, this is budget week. Let's call our senators and members of Congress again and tell them they can create a budget that doesn't punish the poor by taking away nutrition assistance or health care. They can do it. Remember, 79 million people have Medicaid. That's out of about 335 million in the U.S. 42 million of them need nutrition assistance every month just to get enough to eat. If you're religious, I'm pretty sure that every major religion requires taking care of the poor in your midst, not telling them to go away and be sick and hungry. Here's the action. Call your congressperson and your senators and tell them that you demand that they not allow cuts to Medicaid or any nutrition assistance programs. You can reach them at the link in the resource section of the YouTube description box, or on your cell phone, send this text message. SIGN, SIGN, space, PJXWAK. SIGN, PJXWAK to 50409. And here's the message. I'm your constituent, and I want to remind you that 79 million Americans, many in our state, require nutrition assistance to not go hungry at night. Nationally, it's 42 million people, about 13% of the U.S. population. 79 million of us have Medicaid, otherwise we can't afford health insurance. That's about 24% of the population. I do not want you to allow any cuts to nutrition assistance or Medicaid in the upcoming budgets. Moreover, since core inflation, as of the end of January 2025, is 3.3%, here in March it's actually worse, I want those budgets to go up by at least 3.3%. You can ease off on tax cuts to the wealthy, have the IRS go and collect from tax cheaters instead of laying off IRS workers, and you can make corporations pay a fair rate instead of skating by at 15%. You were elected to protect your constituents, not send them to bed at night sick and hungry. I promise I will watch your actions, and I'm going to share what I see, and I will vote accordingly. That's what I've got for you. Go send the action. It's really important this week. Down below, you can like, share, and subscribe. Send me comments here or at healthcareadvocacy1, all one word, @gmail.com. Have a good evening.